listens, and I realized that this was absolutely the program for me. It was a program that was going to equip a nurse with all aspects of the clinical and business side of healthcare. It was going to provide a way to take care of not just a patient's clinical picture, but everything, all of the other domains that surrounds a patient's life as they're coping with health strategies. So I was really excited about that. So I was able to get my degree in adult health nursing case management.
The great thing about being a case manager is you get to practice nursing in such a variety of settings, right? Case managers can be found in the hospital, in physician offices. In my case, I worked in a window and door factory as part of a risk management division. You can work literally in the community. I was a community-based case manager going into people's homes. There is so much you can do as a case manager that is outside of what would be considered traditional nursing practice. And for me, that was the takeaway for being a case manager, was there was so much I could do in so many different settings. And I was recruited for a job in risk management doing workers' compensation case management. And the minute I started doing it, I knew I had found a home. I knew case management was what I wanted to do in my nursing practice. Case management is always going to be a secondary specialty. I think you need a good grounding in the basis of case management, because the most important thing a case manager brings to the table is options. A case, as I don't know how many times as a case manager I've said to either a physician or an attorney or a client and said, I once had this case that, or I remember seeing a case or a patient that. And so folks who become case managers normally have some sort of background, either in medical surgical nursing or ICU nursing, as was my case, or something like that. But if you're looking for something different than nursing at the bedside, case management is a fantastic option. Case managers are essential for not only facilitating those transitions, but making sure that those patients receive the services and the care that they need. And I think case management will only continue to grow because of those needs.
Yeah, that's part of that professionalism. You have the skills to understand that, emotional intelligence, for example, is important. Diversity and inclusion, all of those are important. Understanding cultural implications, all of that's important. And in order to understand that, then it's professionalism that motivates you to acquire those knowledge, skills, and abilities so that you can operate effectively in all of those spaces. So I absolutely agree.
I think case management is only going to grow simply because our healthcare system becomes more integrated. Case managers are involved with every facet of the continuum of care. So as we see more vertically integrated practices and emphasis on transitions of care and people being taken care of in the home.
Telehealth, telemedicine, as you said, has been around a long time. I think for case managers, one thing that technology has done as a direct result of the pandemic, we've been able to use these virtual communication platforms to not only connect with our patients, but to connect with each other. I mean, I like to say that innovation is in the DNA of every case manager.
Being a case manager is you still get to practice nursing. I've been a nurse for almost 36 years. It's one of the best decisions I ever made. I wake up every day not regretting that I chose nursing as a career. It is, to me, the best way for me to practice nursing.